Hi there, I am Dr. Vivek A.N. I've been practicing orthopedic surgery for the last 15 years. Now, coming to the treatment of back pain, we would probably consider what are the main reasons for back pain which would require orthopedic interventions are those related with the disc issues. Now, what is a disc problem or what is a disc prolapse? Now, our spine is made up of multiple bones. They are 33 in number, right from your neck right down to your pelvic bone. Between every bone, there is something called as a disc. Now, this acts like a shock absorber. Whenever the disc prolapses or whenever, because of various reasons, the disc can move out of its place. When it moves out of the place, it can impinge on the nerves which are on the back of your bone. Now, these nerves are the ones which supply to your legs and your thighs. Any kind of problem involving in the spinal area will have symptoms on the leg, which we commonly call as sciatica. Most often than not, a disc problem will cause pain. The other symptoms which are sinister or which we pay attention are changes in sensation like burning, pricking, or pins and needles sensation means that the amount of pressure on the nerve is slightly high. The other symptoms which I would say are important are weakness in particular group of muscles and inability to walk or use your muscles effectively. Any of these symptoms in terms of your sensations being more, there is weakness in any part of the body, probably that would be emergent for you to get examined by an orthopedic surgeon. Now, whenever we suspect problems associated with the disc, we do a thorough physical examinations where we try to insight the symptoms which are caused by the disc. If the symptoms and the signs are significant, we do an examination where an X-ray is done to know the status of the bones inside and a test called an MRI. This MRI will pick up even minute disc bulges which may be impinging or putting pressure on the nerves. Now, most often than not, we see that people go in and do MRI scans by themselves for any back pain. Most commonly, we see that majority of our population, about 10 to 15% of population will have minor discs. Now, every disc problem does not cause back pain or symptoms associated with a disc problem. Very commonly, we see that people who have minor disc problems may not have pain which is because of the disc. So it is only when the MRI findings correlate with the physical findings, then probably we should consider correcting the disc issues. Then what are the common causes that a person has a disc on an MRI whereas his symptoms may be because of other reasons? This is almost like 95% of the times we see that they may have minor discs, but yet they don't have that may not be the main reason. So initial treatment would involve use of pain medications to reduce the pain and do exercises, correction of correction of posture and ergonomic modifications will solve these problems in almost 95% of cases. Very rarely we come across situations where an emergent surgery may be required. Even people who have symptoms associated with disc prolapse, not everybody needs surgery. People who have pain and minor symptoms will be definitely put on medications and exercises. If the relief is not obtained in the estimated or the tentative period of time, then those are the people who may require surgery as one of the treatment modalities.